Hello everyone, we are from student group discussion B8 and now we will present our student project with the title Therapy Aspect of Protein Diet in Managing Renal Failure for Diabetes Mellitus Type 2 Patients. First of all, let me introduce myself. My name is Fiona Natania Santoso with my last three digit student number ID are 249. And here are our members as you can see on the screen. And our student project will be divided into three chapters. The first one is introduction, and the second one is content, and the third one is conclusion. And the explanation will be explained by my friend. Thank you.
Let me introduce myself. My name is Ana Agung Istri Arianggeni. With my last three-digit register number is 233. Now I will present about the background of our student project. Diabetes mellitus is a common chronic disease affecting millions worldwide. It leads to serious health complications, including kidney failure. Diabetic nephropathy is characterized by damage to the small blood vessels in kidneys, leading to a gradual decline in kidney functions. The management of diabetic nephropathy involves a multi-phase approach, one of which is dietary therapy. Dietary therapy is a key aspect of managing diabetic nephropathy and slowing kidney damage. Two approaches to dietary therapy are low protein diet and normal protein diet. Based on the background, the researchers is interested in studying the therapy aspect of protein diet in managing renal failure for diabetes mellitus type 2 patients. Maybe that's all for the background, and for the next explanation will be explained by my friend. Thank you.
The next slide will be presented by me, Nilu Putu Mahaputri Kayika, with the last three-digit number 155. So the problem formulation of this paper are: how should one formulate a question regarding the therapeutic impact of a protein diet in managing renal failure for diabetes type 2? Which journal provides the most comprehensive data about the therapeutic benefits and safety? And how can a critical appraisal framework be used to assess the therapeutic effect and safety of a protein diet in managing renal failure for diabetes mellitus type 2? And the writing purpose is to comprehend the question formulation. The second one is to find the best available journal. And the last one is to be able to conduct a critical appraisal to determine the therapeutic effect and safety of a protein diet in managing renal failure for diabetes mellitus type 2. And the benefits of this paper, including providing medical student in credit structure and well-written critical appraisal, emphasize the student understanding about the topic, such as to build the question formulation, clinical research, journal searching, and also the application of evidence-based medicine. And the last one is this paper could be used as a reference for future critical appraisal on the topic about renal failure therapy. So that's it from me. Thank you.
My name is Gusti Agung Ayu Adinda Letters Putri with my last three digits of student numbers are 232. So today I'm going to explain about the journal searching in our student project. So in this student project, we have searched using PubMed Advanced Search, and the keywords that we are used are adult and diabetes mellitus and low protein diet and normal protein diet or normal protein or high protein diet or high protein and renal failure or kidney failure or renal function or kidney function. And to attain the best evidence, we limited the search only for the last 5 years to be displayed. For this student project critical appraisal, the writer chose the article named The Effects of Different Quantities and Qualities of Protein Intake in People with Diabetes Mellitus. This article was published in 2020. The methods used in this article was a meta-analysis of randomized intervention studies and perspective of observational studies. I think that's all for me. Thank you.
Thank you for the opportunity. My name is Diana Ningrum, and I will explain about critical appraisal. So, critically appraised, the journal article will follow a structure framework such as critical appraisal skills program checklist. The first question, what is the research question? The study explored the effect of varying protein intake on metabolic and renal outcome in people with diabetes mellitus. The question is highly relevant given the dietary recommendation implication for diabetes management. The next one is methodology appropriate. The study design is a systematic review with meta-analysis using the grid methodology was employed. The next, it is about the results are valid. It is find that the research have a bias, funding source from pharmaceutical companies called introduced bias, though the author declare no influence on the finding. And this is about the result, implication, and limitation of the study.
My name is Zephania Ekklesia, and the last three digits of my student ID number are 127. Now I'm going to be explaining about the strengths and weaknesses regarding to um, the article that we're using. For the strength, first, the article provides a safe and practical recommendations of protein intake for type 2 diabetes mellitus patients that have moderate renal failure. Second, the article has a comprehensive evidence by gathering findings from RCTs and meta-analysis, which offer a broad perspective of protein diet. And lastly, the article demonstrates a practical approach in patients management. For the weaknesses, it lacks of long-term data and conclusions are mostly made from short-term studies. Second, inconsistency between the suggestion and the result of the article can be found. Lastly, the reliability of the recommendations effectiveness is questionable.
Hello, my name is Putu Bintang pada Kirana with the last digit of student number R033. Okay, so I will be explaining about the applying evidence by clinical expertise, patient values, and value-based medicine. So the evidence suggests that maintaining normal protein diet, approximately 0.8 grams per kilogram body weight, is generally adequate for individuals with mild renal impairment in diabetic nephropathy patients. For a low protein diet, or from 0.3 to 0.8 gram per kilogram body weight, the study indicates a slightly reduced the decline in GFR, but the effect is not significant. Lastly, for high protein diet, the study found no significant effect of low protein as compared with normal protein diets. For the clinical recommendation, normal protein intake minimizes malnutrition risks and supports metabolic control, while low protein diets may risk muscle wasting and nutritional deficiency. In addition, the negative impact of high protein diet on GFR cannot be proven. As a result, the recommendation for a low-calorie diet with normal protein intake may be more beneficial for weight management and metabolic control, which are crucial for diabetes management. It is also equally important to apply a patient-centered approach by involving the patient in the decision-making process, considering lifestyle and preferences, educating on diet options to support informed, sustainable choices. That's all from me. The next part will be explained by my friend. Thank you.
My name is Kusuma Mulya with the last three digits of student ID is 151. Here I would love to present the 212. So because framework and clinical research questions for this study is there are four components. The first one is populations are adults with the diabetes mellitus and mild renal failure secondary to the diabetic nephropathy. The second one is intervention is low protein diet, typically less than 0.8 grams per kilogram body weight per day. The third is comparison is normal protein intake, and the fourth is outcomes include preservation of the kidney function measured by the higher GVR and progression of renal failure.
Allow me to introduce myself. My name is Carla Manullang with my last three digits are 146. And now I'm going to give about clinical research question for our student projects. So the first one is in adults with type 2 diabetes mellitus and mild renal failure, do low protein diets have a better effect on improving kidney function compared to normal protein intake? And the second one is in adults with type 2 diabetes mellitus and mild renal failure, do low-protein diets more effectively slow the progression of renal failure compared to normal protein intake? That's all from me. The next part will be continued by my colleague. Thank you.
My name is Ariela Kilisarjo with last digit name 247. Now I will explain about the type of questions in question formulation. When addressing the therapy aspect of a protein diet in renal failure, it is essential to formulate type of questions based on the scenario mentioned above. Regarding the types, research questions are classified into two types, background and foreground questions. Background questions provide broad information and typically seek general information about the topic, such as the role of dietary protein in kidney function, why is protein intake restricted in patients with renal failure, and others. These questions help clarify fundamental concepts and include question root, such as who, what, where, when, how, and why, also disorder, test, treatment, and other aspects of healthcare. Foreground questions, on the other hand, are specific and often designed to inform clinical decisions or focus research. These questions can be structured using the PICO framework and focus on specific clinical comparisons. For instance, whether a low-protein diet slows renal failure progression better than a normal protein diet, its effect or impact on nutritional status. I guess that's all from me. The next explanation will be presented by my friend. Thank you.
Good morning, everyone. My name is Ledwin Meikel Wibisono with the last three digits of student number 061. And now I'll continue the presentation. Next slide. Now I'll explain about applying evidence by clinical expertise, patient values, and value-based medicine. So the value-based medicine emphasizes optimizing the patient outcomes by integrating the clinical benefits, patient preferences, and cost effectiveness. This journal article demonstrated alignment with the FABM principles through several key considerations. So first, it focuses on the patient-centered outcomes, and the second one, the article implicitly supports personalized nutrition by assessing both the quantity and quality of protein intake. And the third one, while the study does not explicitly address cost effectiveness, its finding inform practical dietary modifications that are both accessible and sustainable. So, finally, by considering socioeconomic and cultural factors, the research answers that its recommendations are applicable to diverse populations, enhancing its utility in real-world settings. So that's all from me. Thank you.
Okay, let me introduce myself. My name is Putu and the last three digit of my student ID number is 227. Okay, so in this slide, I would like to give you a summary of our student project. So the making of this student project involves journal searching and implementation of a critical appraisal framework to answer the formulated clinical research questions. And based on that, we managed to gather some of these following data. First, low protein diets. They are associated with a potential reduction in kidney strain and a slower decline in GFR. However, their long-term effectiveness is uncertain with issues like malnutrition and low patient adherence. Next, normal protein diets. They are capable of maintaining adequate nutritional balance and do not significantly accelerate renal failure, and so they are considered safer and more practical for usage, especially for those patients in earlier stages of renal impairment. Next, high protein diets. They are capable of short term metabolic benefits like weight loss and improved blood pressure, but their long term impact on GFR remains unclear. And so, caution is advised for the usage, especially for patients with advanced renal disease. Based on those data, this paper concludes that the approach to dietary protein management should be evidence based and patient centered, taking the patient's individual needs, health, and lifestyle into consideration, aiming for culturally appropriate, cost effective, and accessible treatment. That's all from me. Thank you.
Okay, so that's all our student project presentation. We would like to say sorry if there's any mistake in our presentation, and we would like to say thank you for your attention. Our presentation will be ended here. Thank you.